Speech therapy. Today we'll learn more about oral language therapy, social emotional skills therapy, speech sound therapy, speech fluency, and more. So there's lots of different titles and terms for speech therapy, and a speech pathologist like speech and language therapy, speech and language pathologist, speech and language therapist or speech therapist, and a lot of them mean the same thing. They're just used internationally depending on what country you're in, but they're all really talking about doing speech, language, and communication assessment and therapy. Let's have a look at the different types of speech therapy. So, language therapy. Language is the communication of thoughts and feelings through symbols such as sounds, gestures, or written words, which uses a set of shared rules. Language therapy focuses on understanding and saying words, understanding sentences and following directions, using appropriate grammar and sentences, and understanding and telling stories. Speech therapists often focus on oral language therapy, so the speaking and listening, but also sometimes do reading and writing. Language therapy can help your child communicate their needs and wants, understand what is being said to them and follow directions, ask for and accept help, use more words and longer sentences, use correct grammar, and tell stories. Social emotional skills therapy. Social emotional skills therapy focuses on understanding one's own emotions, thoughts, and values and how they influence behavior, managing emotions, thoughts, and behaviors effectively, making caring and constructive choices about personal behavior and social interactions, understanding the perspective of others and emphasizing with others, and establishing and maintaining healthy and supportive relationships. Social emotional therapy can help your child look towards the person talking, develop their play skills, use greetings and start communication, take turns, share and join in with others, make and keep friends, understand social situations and social rules, cope with sensory challenges, for example, sounds, textures, smells, tastes, movement in busy environments, cope with change, like changes to routine, understand emotions such as happy, sad, stressed, worried, frustrated, and stay calm and regulate their emotions. For example, anxiety, anger, or tantrums. Speech sound therapy. Speech is using the tongue, lips, jaw, and other speech organs to produce sounds and use sounds in words. Speech sound therapy focuses on listening to sounds in words, saying sounds with vowels, saying sounds in words, saying sounds in phrases and sentences, and saying sounds in conversation. Speech sound therapy can help your child pronounce words and sentences correctly. Speech fluency therapy. Speech fluency is the smoothness of speech in terms of its rate and flow. Stuttering is characterized by a high frequency or duration of stoppages in the flow of speech. Speech fluency can help your child speak fluently without getting stuck on words. That's our quick overview today of speech therapy and the different types of speech therapy that are offered.